Welcome to the Dr. Mudgil podcast. This is episode 173. We are rapidly approaching the Ides of March. Now, it's the one of the few things I remember from Shakespeare from high school, but the Ides of March are approaching. Spring is in the air. A couple of beautiful days here in the New York City area. Sun's been shining. It's like 60 degrees the other day, so it's getting a little nippy, taking a nippy turn, but I'll take it. You know, we're above freezing, and we got some beautiful spring-like days on the horizon. So all good stuff. All right, so we're going to take a little turn here from the content we've been posting the last couple of weeks. I've just been on a tear with some insurance bashing and that sort of stuff, which I most certainly will be back doing, I'm sure, once I get inspired again to do so. But I wanted to take a turn, wanted to kind of talk a little bit more about sort of like a mindset, thoughts of the week type stuff. So I'm going to dive right in. I've had several pieces of content, through the many years that I've been doing this now, about, no one's going to come save you, or, just getting things done, et cetera, et cetera. But I thought it would be a good time to revisit that. Especially in jobs that you have where folks are really depending on you, not only your coworkers, you have a team, and your team is depending on you to make sure the machine works in its a well-oiled way. But when you're in healthcare, your patients depend on you. I remember, years ago, it was not that long ago, but a few years ago, when my granddad passed away, and we were very, very close. He lived with us growing up. I was kind of juggling, obviously, the grief and all that sort of stuff, and kind of organizing the family and doing the things that needed to be done. But I was also running a practice. I have employees, I have patients, folks are depending on me, and I remember really feeling it at that time, kind of getting pulled in multiple directions. I wanted to be with my family, and I spent a lot of time with my family, but I also had a responsibility to take care of my patients and to manage the business of my practice. And, I just remember telling myself, just suck it up. You got to get it done. The folks are depending on you. My family was depending on me. My patients are depending on me. My employees are depending on me. And, there's times in life where you're getting pulled in multiple directions. But if you're sort of the focal point of folks depending on you, you got to kind of manage it. There's just there's no alternative. No one was going to come save me. I had multiple people that were depending on me, multiple things that needed to get done in various forms of my life. And there was no alternative but to get it done. And that's something I've talked about a lot, getting your daily wins. In that period, there were multiple daily wins. I had to be present for my family. I had to be present for my patients. I had to be, present as, the quote unquote boss of Mudgil dermatology. And, there was no choice. There was really nothing else that could be done. I see it with my wife, who's amazing, literally juggling a million things. Kids need her for this, her patients, she's a periodontist, patients need her, she's just juggling so many different things. And, very much she has that same mindset. There's no choice. You have to fulfill whatever responsibilities are on your plate. That doesn't mean that you can't go on vacation, you can't take your foot off the pedal at times, and kind of focus more attention in certain parts of your life and less in other parts of your life. But the bottom line is the job needs to get done. Our patients need to be cared for. They're depending on us, and it's our job, it's our responsibility. It's what we signed up for, to deliver for our patients in the best way that we can. I'll give you another example. Back in 2020, I had emergency back surgery. So I was away on vacation for a week. It was the week of spring break that my kids had. We were down in Miami for a week, and my back was in really bad shape for many, many years, but it was slowly deteriorating through that week. And we came back on a Friday night, and Saturday, while I was kind of trying to get through a workout, I realized that I couldn't lift my left leg. It was acutely paralyzed. I was ooh, that's not good. But there's a patient that I had to see in my Long Island office that Saturday. So I just literally hobbled into the office. I saw the patient, did whatever needed to be done, and then I went off to get an emergency MRI. And my plan was I'm probably going to need surgery at some point because I knew something was definitely quite wrong with my back. And the spine surgeon actually called me at 9 o'clock on Saturday night and said, "Hey, you need to come to the emergency room tomorrow morning. We need to operate on you like yesterday." So Sunday, this was during COVID. My wife dropped me off at the emergency room. She couldn't come in because COVID, you couldn't have visitors in the hospital, and I had to go through the emergency room because I had to get COVID tested before I could get surgery. It was during the peak of the pandemic. And then, I had my back. I had emergency surgery on a Sunday. My wife picked me up at like 9 o'clock at night on Sunday night. And because I'd been away for the week before, I'm a pathologist, so I read slides for a lot of my colleagues, dermatologists, plastic surgeons, et cetera, in the New York City area. So I knew that stuff was sitting there, waiting for me, and like folks were waiting for their results. So that next Monday morning, literally like 12 hours, less than 12 hours after having emergency surgery on my back, I came to my office, read my slides, got out whatever reports I needed to get out. And then because I'd been away the week before, I had a lot of patients I needed to see. So that next Tuesday, the very next day, I was back in the office seeing patients. Now, I'm not saying that that's normal. And I'm not saying that's really what's expected, but there was just a bunch of responsibilities that I was shouldering, and there was I was the only person who could execute these tasks for my patients and for all the things that needed to be done, and there was really no choice. No one was going to come save me. So the point of all this is, responsibility is a very important thing to respect. When folks are relying on you now, whether that be your coworkers, whether that be your patients, whether that be your kids or your parents or your friends, it's important to deliver. It's important to respect and recognize the responsibility that you have. The expectations that folks have of you, and it's important for yourself to deliver. It makes you feel good. It gives you a sense of worth, which is very important. So with that, I hope you all have a wonderful, restful weekend, or just ready to crush the week ahead. Let's get it.